I also double as the one in charge of the COVID treatment center. And I can tell you, through the emergency, at the moment, we have only one patient. In the past, people are actually banging on our doors to bring in suspected cases. So it's gone down. At the COVID treatment center, we don't have more than 15 patients. In the past, we've had over 28 patients on a daily basis, despite discharges. So it looks like we are not getting a lot of cases coming to us, which, as I said, is consistent with what Ghana Health Service is reporting. So the danger here, you may think, oh, we are getting less cases, but it could be that we are actually not picking new cases because they are not coming for testing. Even with our OPD system for COVID, the attendance have dropped. With our Lusky app, patients accessing the service, it's dropped. So I can't tell whether it is a true reflection that people are adhering to the safety protocols and so we are not getting exposed, we are not getting cases, or is it that people are not really coming in to assess the service? I can't tell. At this stage, it's difficult to say. But in the next few weeks, we'll see whether it's the reality or it's something that is not coming to our attention. It's a very dangerous path to take, to think that because you've had COVID before and it was mild, so no problem. What about the next person to you that you could easily infect, who may not be as lucky as you and may have a severe disease? And don't forget, Ghanaians in general don't do a lot of what we call routine medical check. So there are so many people walking about with chronic illnesses they have no ideas of. And then you get infected with COVID. In fact, let me tell you, about more than half of our patients, we've actually diagnosed them with chronic illnesses when they come in. They had no idea they had those chronic illnesses. And we wanted to be sure it wasn't the COVID that was pushing them to have such parameters. And when they were about recovering, those parameters were still there. So for me, it's a very dangerous path to chart, that to say that because COVID is mild, let's continue with our life as normal. I have a problem with that thinking, okay? And secondly, yes, we're not dying as other people. We may not know the actual reason. It could be beyond the fact that the demographics could be in our favor. We don't know other hidden, a lot of people have subscribed to, the intervention of the divine, which as Christians or as faith-based people, we tend to believe that. But going beyond that, I think we should be very, very careful the way we handle this COVID, because we don't have the health infrastructure like other countries in the West. And they are having a lot of challenges. You see, UGMC is here, Ghana East is there, they just had the Ghana Infectious Disease Center, 100 bed. How much is our population? We are way beyond the existing facilities. So it's very dangerous for us to assume that because the disease is mild or we've not lost so many people, to relax and go back to life as normal. Israel, to be honest with you, if you take outside Accra and probably Kumasi, which regions in Ghana can actually boast of significant infrastructure to take care of COVID if they need severe cases? Look, I sit here and I get calls around the day, midnight and stuff, people being referred from Western region, people being referred from Kumasi, even Kumasi referred cases here. Just to let you know how serious the issue is. It's not my place to come to the media and cause fear and panic. But the reality is that, yes, our cases may, in quotes, appear to be going down as in active cases, but there could be other reasons, as has been discussed on this platform, that may be why we are getting smaller cases. But for me, where I sit now, I will not recommend to anyone, irrespective of their agenda, their political status, that we are out of the woods, so everybody should relax. I will not recommend that. I even have issues with some of the restrictions, like easing of restrictions, like the trotro.
I love it.
I have a serious challenge with we just saying we should wear face masks and so we should be in trotro and no social distancing. I have a serious exception to that advice. I don't know who informed that policy.
What is it that you know that the people who advised government to take that decision don't know?
we are in church. You say because people are singing in church, so they should have social distance. Who tells you is right? In Toronto, people don't talk in Toronto. People sit in Toronto and sell drugs and see all sorts of things. People even preach in Torontos and other buses. And we've all sat in Toronto and buses before God bless us and we have our own cars. There are activities that goes on in cars, especially public transport. It's not different from what goes on in the church. So how then do we skew our restrictions? I don't get it. I don't know. I know some people may be angry with me for saying this, but it just doesn't make scientific sense to me. Seriously, it doesn't. It doesn't at all. And that is how I feel about this Toronto thing. Seriously, Israel, I'm not happy about it.